Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown, and I'm here with a really awesome guest today. His name is Dr. Steven Justesen, and he's from the great state of Montana. And we were really talking today about laser dentistry. So, we're in a really exciting time, I think, in dentistry right now. I think possibly one of the most exciting times in dentistry ever. Um, you have intraoral scanners, you have lasers, you have mills. There's all this technology, and really up until like 10 years ago, dentistry technology wise hadn't really changed much. And I think there's been a technology like arc that's happened that's catapulted us pretty far into the future. And we've talked about mills and ortho scanners. We've talked about 3D printing, surgical guides on here. We haven't talked at all about lasers yet. And lasers, yeah, I think is a great area of dentistry. And just on a broad strokes surface level, for a lot of practices, it removes the need of the drill. And the drill is one of the most fear invoking parts for a patient. And in my sphere of dentists, the number one expert I have on lasers is Steven. Steven is a client of Energize, our company, works with us really closely. We've had him for a couple of years. And Steven, every time I talk to him, is going away to a laser CE course. He's done a bunch of education in lasers. And I know lasers is his passion. And we wanted to do an episode on this technology. And when we had a meeting about it, I said the best person to talk to is Steven. So, Steven, why don't you tell us a little bit about you, your practice, kind of where you're at, and then we'll get into lasers in a minute. So tell me about you and your practice and kind of your practice journey so far.
Yeah, absolutely. So we're here in Bozeman, Montana. We've been here for about 7 years. We took on this adventure after working, some private practice, some community health experiences, and then decided to go out on my own and purchase a practice. So we came out here and found a practice that was available. Moved into the space and just doing bread and butter dentistry for a long time. And I happened to want to advance my education. And I was like, hey, I really want to figure out like how to do implants better. Like, how can I do implants better? So I went to a course. They talked about PRF and placing, with the centrifuge and the blood and all that, and getting PRF into the mix of things. I was like, oh, this is awesome. And the instructor was talking about, hey, Rick Myron, he's like this guy who does all this research on PRF. And I was like, sweet, cool. This looks cool. And I was at a conference and he was actually speaking there. And his topic was aesthetics in the dental space, but it wasn't like dental aesthetics. It was like facial aesthetics. I was like, wow, that's really interesting and cool. Like, I'd love to hear more about this. Like, this guy's doing PRF and now he's doing like this facial aesthetic thing. Like, what is this all about? And so I go and listen to one of his courses, and he talks about the potential in doing like a med spa within your practice. And one of the tools that they use is a laser. And so I'm like, okay, I need to get this laser because I'm seeing this avenue of like something else that I can do, something other than just dentistry that can help me with a different form of income, a different way of practicing. And who better than someone who deals with the face all day long, right? To take on all these extra things. So I normally don't just jump into something, but that day, for some reason, I felt inspired, and I bought a laser that day.
I want to highlight something real quick. So we talk all the time on the podcast about like the plentiful mindset and betting on yourself and taking a jump. And your peers are very engineer minded, conservative, and really ease into things. And there's a trend of successful guests that are on this podcast that they just do things. Like Sophia Rizzo, I know you've been in a meeting with Sophia Rizzo. She's one of our docs from Minnesota. I was on a meeting with her 4 years ago, and we were going through implant stuff, and they were not sure if they were going to buy a CBCT or not. And during like the video conference together, her husband walked away and picked up a phone and bought a CBCT. And said, we're just going to buy it, right? You just bought the laser. Dr. Vallo, when he opened up his practice 3 and 4, he never saw the space. He just agreed to it over the phone. They called and said, we have a space available. We think it's good for you. He said, yeah, I'll take it. And he hung the phone up and said, I'll figure it out later. So you just popped in and bought the laser. So roughly, how much was the laser? Curiosity. How much was it?
It's $100,000.
$100,000 purchase for the practice. That's like building out 2 or 3 ops with really nice stuff. That's a lot. Like that could be used a lot of places. So you weren't doing the kind of procedures you really needed it for yet, but you wanted the tool right away.
Yeah.
And you jumped in and got the tool. Okay, so
Yeah.
tell us about. So you got the tool. You got, what laser did you buy? What laser do you like? What's your pick on lasers?
Photona, bar none. So most people are like, and I was new to lasers. Like I had done some diodes and didn't know a thing, honestly. And so my education was very minimum with lasers. I just saw the potential that it had, and I didn't even recognize what it could do. So went ahead, purchased it, went and did some education with it, and then found out all the crazy modalities that I could do in dentistry and the facial aesthetics. And then my mind was kind of blown, like, holy crap, I could be doing all these things and improve my practice. So there's you can do the same bread and butter kind of dentistry. You can prep teeth and do it that way. And the beauty of it is I prep a lot of teeth without getting people numbed up. And it's not to say that they don't feel anything. I think that's kind of, a little sneaky to say. My patients, I let them know, hey, you're going to feel something, right? Whether it's cold, whether there's a little zing here.
Well, it's something less traumatic than the drill, though.
Yes.
The drill is traumatic in 3 ways for the patient, right? One, it does hurt, right? So the drill, the visual of it, it induces the idea of pain, the sound of it, right? So like the reality is like, if we focus on like, why is the drill a negative psychologically for the patient? It's the visual, the audible, and the actual pain,
vibration.
Right? The vibration, you feel it, right?
Yeah.
Right. And when you go to the laser, you're not saying this is pain-free dentistry.
No.
But I would say, from the research I've done, is that it's less traumatic dentistry.
I have a patient actually yesterday that we treated, just doing a filling, and this patient on the spectrum, right, of autism and just sights, sounds, feelings, all those things she's very, very sensitive to, and requests the laser. And so I have certain patients that request the laser specifically. No matter what doctor they see, it's like, hey, I want the laser. And so you get a certain clientele that's like, they're geared towards it because they know, number one, it's not going to vibrate like the drill. It's not going to have the same sounds as the drill. Like you're saying, all these different sensories are going off on them. The traumatic things that they remember as like a kid or whatever it was.
Or just the things that honestly, that just general culture is putting your head about the dentist.
Yeah.
It's just not, it's not accurate. It's not very accurate, but like, it's just, you see dentist, you think drill, you think pain, and it sounds bad. The laser kind of like changes that thought path.
Yeah. Yeah. In a huge way, and for the better. And then I'm finding out all these cool things that it can do with endo, with perio, just the things I can do without a scalpel is, and so precise, is incredible, and minimally invasive. And it's just such a nicer and better way to treat it. Not causing fractures in teeth. With a drill, like if we like it or not, you're causing micro fractures within a tooth with that carbide burr, or even with a diamond burr. There's going to be a fracture in there that you cause, not intentionally, but it's just kind of the physics of it.
Well, it's a traumatic thing to the structure of that tooth. You have this metal object at a high rate of speed, basically auging down through it and pulling out material, right? That's a traumatic experience. I mean, it's really akin to a giant drill drilling in a quarry or a mine. It's just a tiny drill drilling in a tooth.
Yeah. So, I mean, what really geared me towards it was like, hey, I want some kind of avenue where I'm not like bent over, my neck's hurting, my back's hurting, and all these things. And I saw this as one of those avenues as well. Like if I get into the space of like facial aesthetics and things like that, then I'm not having to bend over as much to treat a patient. I can do things a little bit easier. It's all cash flow because I'm not dealing with any insurance with that. So there's like that other side of it. And it's a space that a lot of people desire and want. So all these different things led me to like increase my education on it and be like, okay, what can I do with this? Because now I can treat patients that have snoring issues and tighten the tissue in the back so it's not floppy jalopy. It's not like the soft palate's not vibrating as much anymore, and I can help improve patients' lives. There's an aspect where I can help with pain. So pain on different scales. Let's say somebody has a surgery they just went through, or for example, my wife had Bell's palsy,
Oh,
and what happened was like half her face went numb. She was pregnant at the time, and they weren't able to give her any medications for it because she was pregnant, so she couldn't do the steroids, she couldn't do anything. And so we used the laser on it to help take away the pain, because with it came a lot of pain. And anyway, so we helped her with that. It helped regenerate the neuromuscular connections with things, so her face wasn't just like paralyzed. So there's so many different applications to it. Like we could spend days on it, right? Like I went through their master course, which is absolutely phenomenal, and it helped me understand what lasers are, what they can do. Before, I had no clue. You know, it's like you use this little light, and you're like, I'm burning tissue, is what you feel like you're doing, right? Until you actually understand what's going on, it's a whole new ball game.
I think too, like, I have another doc I know. His name's Jason Graves. He's in like the Pinehurst area in North Carolina. He's local to me, and he's really into laser dentistry too. And like, I think a lot of it is it's on the patient level and the doc level. When we think about dentistry, we don't think about lasers. Like, when you guys come out of school, you're not really thinking about, like, there's all this other cool stuff, but you're not really thinking about that. But it ends up being something where, you know, it it does change the quality of experience of the patient drastically,
Mhm.
and the patient doesn't see it because it's on a micro level. But you're not creating those micro fractures. You're doing better work on the tooth than you would be. So it's a better modality of treatment. Well, you can approach modalities better with it because it's more accurate. It's better for the tooth, the better experience for the patient, and also for doc. So it sounds like it's a worthwhile investment for the 100 grand that you pay for the laser. So if I was a doc, right, and I'm listening right now, I'm like, I want to add lasers to my practice, and Jace and Steven, he decided to jump right in and buy the laser. Like, so if I'm a doc and I call Steven, I say, hey Steve, I'm looking at getting into lasers, right? And I'm gonna buy the laser you bought because I heard you talk about it. What is the next step, and what does the timeline and the journey look like from purchase to being effective with the laser? Because I know, like, with implants, it's like we go to an implant CE course, we place a few implants there, and then we buy a CBCT and we start looking for really good quality cases. I know with implants there's a real heavy learning arc because every case is very different. There's complications. With lasers, I perceive, and I could be wrong, that it's easier to implement it across the practice than it would be less necessarily doing implants right away. So, like, because there's always fillings, there's always other things you could use it on. So what is the arc like, and how usable is it across the practice?
So I started using it right off the bat. Like I maybe I have a different mindset than most people. Like I'm all jump in and get it done, and like I don't let stuff just sit around and go to waste kind of thing. Like if I'm going to buy something, I'm going to use it. Right. So for me, at least, it was one of those things where you can jump in, you can start doing fillings and things like that. There's a lot of presets on there, and those are good starting points for a lot of people who don't have the education right away. So that gets them started, right? Once you've done that for a little bit, you know, 6 months or whatever, and they usually give you a course, right? Actually, I think 2 courses is what they gave me when I purchased the laser. So I was able to go do these 2 courses, get a little bit more educated, figure out some of the settings better. But it wasn't until I went through the master's course that I truly understood like what the laser involved. Now that was a year-long course. It wasn't like every day, but it was like about 4 days of lecturing and like hands-on and things like that. And you did, I think it was like 5 or 6 modalities. One I did have to go to Slovenia for, but they have a whole graduation ceremony. It's fun to do, and like, why not? You know, I get to travel and enjoy
Yeah.
life, and That's partly why we have a business, right? So it was
Experiences.
a great experience, and to be able to go there and collaborate with other doctors that are like-minded and doing the same thing that you're doing. Now, for me, my journey was maybe a little bit different. It wasn't that fast-tracked. I used a laser for probably a year and a half, 2 years before I did the master's program because I didn't know it was available, and I think partly because COVID shut things down for a bit. And then it opened back up, and I was actually able to go to, because they don't have this master's course in the US. So I had to
Okay.
go to Canada, or you have to go to like Europe or Australia or wherever, right? To do this master's course. I think they're trying to put something together in the US, and I'm hoping that I can be part of like teaching it because it's a great course. But like just understanding the physics, their first thing, that's like the most eye opening. After that, it's like, okay, feed me more. You know, you're just hungry to learn more. It's a fantastic course. So after that, you're pretty awesome.
You're pretty awesome at that. So, what
Yeah.
modalities of treatment have you found it most valuable for on a daily basis?
That's a tough question because I use it for every single procedure. There's like I'm sure it's tough for the ladies because they got to wheel that thing around, or they got to like make sure patients are in that same operatory. Um, that's the hard thing, right? Is not having more than one. So
Okay. So,
I
so
use
it
it.
creates a traffic jam.
Yeah, exactly,
It gets hard to do six-handed dentistry when you only have one laser hand.
exactly.
Okay.
So the tough part is like I'll use it for every restorative procedure, not so much on crown preps. Um, you could different modalities, different hand pieces, you absolutely could, but for the most part, you don't use it really for crown preps. Um, but any other restorative procedure, I can do perio procedures. I do all my endo with it. I do all my surgical procedures with it, extractions, bone grafting, tissue contouring. I use it for healing. I use it for everything. So it's really hard to say like what's the one thing you really find value with it. Like it changed my game for endo for sure, but it's also one of those things where it's like, you know, some people use lasers for perio surgery. It's mostly like specialists that you see that, but I have that available in my practice. I can do that. You know, patients can stay within my practice and get that same treatment that that specialist is providing, which is really cool. And patients and they really like that because they're comfortable with you. They want to stick with you, right? So maybe that's what it's.
So, do you think it helps you refer out less?
Oh yeah,
Yeah. So, I know for me, like when I talk to a doc, I try to gauge their aptitude for referring out. So I think, a specialist is important, but I think that a patient, like you just said, they would rather have their care in one location, one continuity of care, one caregiver, than be moved from place to place, right? So I think we can create a better patient experience overall anytime we keep them in one location. And the lasers allowed you to keep most of a good portion of your referring out in house because you can offer that better now, a better quality of care in those modalities in the practice because of the laser.
yeah,
Yeah.
absolutely.
So would you say the laser paid itself off pretty quickly? Like, did you see the return on investment pretty fast?
You see it once you start to learn more, I would say, because in the beginning, you know, you're trying to understand and get to know like what this new thing is, and so you're using it on the same things that you're already doing, right? So fillings and stuff like that. So I can't say right away, um, but I feel like I'm able to do endo procedures a little bit quicker now. I can do these perio procedures with periodontal disease or periimplantitis and treat those effectively, and that brings another source of income. Patients who have snoring issues, that's a
Yeah.
completely different source of income. And then you have the whole facial aesthetic side of things. The whole reason I bought the laser, right? That's completely something different. Like you don't see that in a dental office typically. So that's a whole separate avenue of treatments. I'm doing like, you know, you do hair removal, you do facial peels, you do a facelift with it. You can do vein removal, acne treatments. You know, the list goes on and on, kind of thing. So you can do so many different things with it, and you're adding this whole adjunct to your practice. It's like almost a separate practice within a practice kind of thing.
So it's almost a practice builder, right? It builds a lot of modalities up. So here's a question. So you said the bottleneck is having one. A
Yeah.
lot of, we do a lot of work with the American Academy of Clear Aligners, Dr. Geller's group. We have a lot of their docs, and our super Invisalign docs have like 3 and 4 and 5 iteros, right?
hmm
They're expensive too. I mean, not quite $100,000, but they're expensive, right? So
Yeah.
could you see building a super practice and having like 4 lasers, like one in each op?
Yeah, absolutely.
Like, have you explored actually buying a second one or a third one, like going up a few?
I have explored that option. Actually, I've been talking to him just recently about it. And but the laser that I want to purchase, the next one, is actually all meant for aesthetics. It's like for like the whole body.
Okay.
uh, it's more for like aesthetics specific, not dental.
Okay.
So it's a completely different modality. More power, more. The hand pieces are larger. It's a pretty cool machine.
So you are exploring adding another laser to the practice. That's how much you
Yeah.
believe in laser dentistry.
Yeah.
So if you could, like, if a doc was listening to this right now and you were going to give him a few words of advice for approaching laser dentistry,
Mm-hmm.
what advice would you? So if I call and say, "Hey, I'm thinking about laser dentistry," what would your basic words of advice be to him?
Honestly, for me, it was when I started to get educated. Yeah, I educated myself on, or I sought out education for what was the best type of laser, right? Or what can lasers do, and then kind of go from there and build upon it from there. Because a lot of us, myself included, when I first grabbed a laser, I really didn't know what it was. I didn't understand what it did. I didn't know the mechanisms behind it. So when you understand the physics behind it, and that's a tough one to swallow because nobody enjoys just like, hey, let's do some physics, right? But when you understand the physics, it opens up this whole new world to you, and it's really exciting. So when you understand those physics, it's game on. It's exciting. There's a lot to learn.
If you were to seek these courses, where would you go to find the courses and get on the track to go to Sylvania and get your master's in this? Where would you go to look for that?
Yeah, so Photana has its own website, right? So you just go to photana.com and you'll find there's a program called the LAHA. We call it LAHA Master's Program, and that program will get you introduced into things. That first course will be the physics, and that'll be like the course that really gets you that stepping stone into like understanding everything. After that, they just break it up into things like, I think it's like perio. They do one for endo. They do one for general dentistry. They do one for aesthetics. So they kind of break it up into different modalities from there. And then you go and kind of you have to do some of your own research as part of it as well. So that's kind of cool because it challenges you, right? So you have to have, I think, at least 5 different cases that you have to submit.
Oh, really?
Yeah, you have to
Like
have
little clinical studies.
yeah, so
Yeah, that's cool.
Pictures, health history, videos if you can get them, all these things that you're submitting, X-rays, all this stuff. So you're actually putting together case studies for your master's program, and they grade you on it and they help you out. And they're not there to like make you fail, but they want to help you obviously in improving things and becoming better. So it's really cool. You get to have like somebody helping you along the way.
Roughly how much was the education? Just curious.
Education, I think it was about roughly it's like 2,000 per module.
Okay.
That's not
bad.
including travel, but yeah, that's really not
For
that bad.
dental education, that's a great deal. Dude, there's courses that are like 30, 40, 50 grand.
Yeah.
$2,000 a module for a new tool like that in the practice and be practical at it. That's a
Yeah.
really good deal.
It is. It really is. Because you think about it, it's like you're like a laser master after that. Like you really understand things after that. And I think of some of the other things I've done, like with implants or other things, it's like you probably pay twice that.
I think one day I figured it out. CBCT, going to a CE course in South America, placing implants, travel, everything. I think if you're a G, and someone can say, Matt, you're wrong. I am, but if you're a GP who isn't doing implants at all and you don't have a CBCT yet, I think all plus handpiece plus everything else, I think all around I figured out one day it could be like 150 grand from beginning to end to get into implants.
Yeah.
So $100,000 laser, let's call that the CBCT of implants. That's the tool you need,
Yeah.
right? And then $2,000 a module for education. Pretty good
Yeah.
to add something that high tech that changes the patient experience overall and opens up more windows of revenue through other modalities of treatment. It's a pretty good investment.
Yeah. Word of mouth starts to get out there too. And people start to realize that, hey, you do this, and they start to seek you out. They start to know that, hey, this guy, he does things differently. And I like the fact that he has all this technology and that he's willing to invest into his practice. That means he's willing to invest into me as a patient. So I think that's been a big game changer for us as people see our practice. We have a lot of digital dentistry going on. We have our own lab. We have the laser. We have the facial aesthetics. We have a lot of things that we've invested into the practice. And so I think patients see that and they're like, you always have something new here. I love that you're always like moving forward with things. So patients notice that and they really appreciate that you're willing to invest into them.
I think docs go like one of two ways, the technology. There's docs that buy technology go two ways, is what I find. One is they just want the technology. And I got docs that buy it and then it sits there like, I got a 3D printer. I'm like, cool. How often do you print surgical guides? Not there yet. How long you had that? 7 months. What's your plan on getting there? And the thing is collecting dust. Like I'm in practices, like, let me show you my new toy. It's right there. It's a 3D printer or whatever it is, right? And I'm like, cool. I start asking them like, how much have you used it? Because I'm really into the technology part of it. I think this is like the fact that we can take an intraoral scanner, scan someone's mouth. We did an episode on full digital workflow with Dr. Sasha.
Yeah.
And we can scan a mouth,
Yep.
3D print everything, mill the zirconia appliances there, and do everything from scan to design to delivery of the product in one building with you guys overseeing the quality the whole way. I think is really awesome. But I have docs that are like you and Sasha and my one doc, Nate Graves, who are like into technology, but I think what happens is you're not really into the technology, you're into the outcome it provides for the patient. And that's what motivates you guys to get to using it as soon as possible. I get a lot of docs who buy the technology and they put it in a low technology room or a lab room in the practice. They go, I have these things. And then there's a level of lack of like clinical bravery to push where you were like, I'm buying a laser now. I don't know how to use this thing. I'm going to figure out how to use this thing. I'm going to start using it right away because I just spent 100 grand on it. And really the only way you get good at something is doing it.
Oh, yeah.
Right. So I find that docs that buy technology end up in one of those two camps, in my opinion. And you're definitely on the side of I have it, I'm using it. I bet the day it got delivered, you were probably there late that night setting it up. And I know exactly what happened because I know your wife and your family. Just so you guys know, Steven has 11 kids or 10 kids?
11.
11. Steven's got 11 kids. And his wife's a hardworking woman. I've met her a bunch of times. His wife's a warrior. So I know what happened. The laser got delivered that day. And you got unboxed. The practice shut down. And you didn't go home. You stayed there setting the laser up. And she was calling you, asking you when you were going to go home. And you realized 11 o'clock at night you were still there, didn't you?
All the time.
Yeah. So because you wanted to use it, right? So I think that's kind of the thing too for docs is like, hey, if you're going to invest in this, have the bravery to start using it. Like you buy these things with the spirit of I'm providing a better experience for my patients. I'm going to cut down my costs in a lot of areas and make my job easier. Well, for that to happen, you have to use it.
Yeah.
Right. And you started trying to find places to use it everywhere in the practice. So you use the laser all day.
And then you're finding new ways to use it all the time. So it's like, hey, I got to uncover this implant. Let me see what I can do. And the great thing is when you go through and get this education, you now learn the presets, but you also know how to change things based on like the tissue type, what's going on, what different circumstances. And you're like, okay, well, it's bleeding a little bit more. I could use this because this laser, the beauty of Photona, it comes with 2 wavelengths. Every other laser out there is 1. Nobody else does 2 in one machine. Nobody. So this thing, I can say, okay, I want to use this wavelength or I want to use this wavelength. If I change this setting, I can do this. Yeah.
Is one wavelength like more suitable for soft tissue and one's more suitable for hard tissue? Like, what is the benefits of each wavelength?
Yeah, so there's one that's definitely in particular to hard tissue, but you can use it for soft tissue as well.
Okay.
The other one you can use for a lot of soft tissue, and then you can also use it for healing, which is really cool. So if you've ever heard the term photobiomodulation, that's something that a lot of people are starting to get into now. They call it like low level light therapy, or red light therapy. Is, somebody's just taking one wavelength and they're saying, hey, this is photobiomodulation. You can use it with a lot of different wavelengths, but the whole aspect of it is it's starting to increase healing in an area, decrease swelling. There's a whole cascade of events that happens for this. So that's like that wavelength penetrates the deepest, the best, compared to other wavelengths. I'm not saying other wavelengths are insignificant or bad or anything like that. You can use them as an adjunct. We have one where it's LED, but it has both red light and blue light as well. We have it as part of like our aesthetic side of things. So somebody comes in, gets a hydrofacial, and we put this red light, blue light over top of them while they're sitting there, and it helps improve the collagen and all these things. So there's so many different things that you can use all these wavelengths for, and it's understanding what you can do and how you can treat patients with it.
What was your biggest aha moment? I'm in my head as you're telling us this, like all
Mm-hmm.
these different modalities, all these different uses. And one day you open up someone's mouth or a patient's in the chair or whatever, and they have a need of X.
Mm-hmm.
And what was the biggest moment? Like, that's the laser this way. What was the biggest aha moment you had of like, I never thought of that, but laser is the application for this? That surprised you. What moment surprised you the most of how you used it?
That's a good question.
There had to have been one moment where you were like, I never thought when I bought this laser of using it this way, and now I'm using it this way.
Well, I did do one case. I don't know why it's standing out right now because I'm sure there's others. But there was one case where I had a patient that just had a denture. She's had a denture for a long time, right? Upper denture, she has lower teeth, but it's starting to become hard to fit. It gets that that gingiva that's kind of getting all wrinkly and everything because it's rubbing a little bit more. The mucosa is sitting lower. So I'm like, man, we need to do a gingivectomy. She needs a frenectomy, and she needs an alveo, or not alveoplasty, but she basically needs everything lifted up so she has more room for this denture. I'm just like, oh man, this is a lot of work. I'm like, holy crap, I can do all of this with the laser because it's all soft tissue based. I can do it with my erbium laser, and I have this certain handpiece that I just got. That's they call it a chisel. It's very, very flat. It's very, very thin, so it looks like a scalpel. And I went through. We did the gingivectomy. We did the frenectomy, and then we did the vestibuloplasty. So we raised things up, and everything healed really, really nicely. And that's the beauty of a laser. You don't get the inflammatory response that you do with like a blade.
Because you're not. It's not traumatic to the
Yeah,
tissue.
exactly.
You're not ripping. I mean, like no
Mm-hmm.
matter how sharp the scalpel is, you're
Yep.
still ripping tissue.
Mm-hmm. Mm-hmm. Exactly. Now, it also depends on the type of laser you're using. So other lasers can cause a more traumatic response. So anyways, just knowing which one to use. So afterwards, things healed really, really well. I remember just seeing her for just a periodic exam. I was like, hey, how are things going? Because we relined it afterwards. And she's like, it has never fit better. And this is somebody who's been in this denture for, I don't know, 20, 30 years, right? And to hear that, to have that kind of effect for her was huge for me. That was huge. It was just like, wow, this really, really worked, and it worked really, really well. And it was so atraumatic. I loved it. And I'm like, I need to do more of this.
So we had a better experience for the patient, better
Mm-hmm.
healing.
Mm-hmm.
And would you say doing the work was a better experience for you as the practitioner with the laser or with the scalpel?
With laser for sure.
What makes it better for you? What is the contrast? What makes it better for you with the laser?
I think one of the things is I can see more of what I'm doing.
Oh, 'cause the scalpel's not in the way.
The scalpel's not. It's the same thing with a drill. When you're drilling out a cavity or something like that, you can't really see what you're doing. Like with the laser, I can actually see the tissue, the tooth structure being removed.
Because the laser's away from the surface.
Yeah, exactly.
So there's a margin there
Yeah.
from laser to tissue.
Yep.
Where with the other two methods, either a scalpel or a drill, it has to be tool to tissue.
Yeah.
And this is tool removed from tissue.
Yeah. And sometimes the bleeding gets in the way with like a scalpel, things like that. And it's like, oh, I need suction. I need something. You know, with the laser, you still have a little bit of water, a little bit of air going at the same time.
Does it cauterize as it goes?
It does have like an air compressor with it and everything. And so it's got a pump essentially.
Okay.
So it has its own water supply and
Okay.
you just, cancer, just like your chairs. Right.
Okay.
So, yeah, it's pretty amazing what you can do with it. And just the fact that you can see so much better.
So for endo, it's got to be way better.
Oh, yeah.
It's got to be because so listen, I'm not a dentist. And you guys all make comments about isn't a dentist. I'm not a dentist, but I watch you guys, right? And I had a periodontist. He was not periodontist. An endo guy, endodontist. He was in Raleigh, and I went and watched him for the day because I wanted to learn more about endo. And like every time the patient's head moved, everything came out of focus and stuff. And he's always trying to see around the drill, and it looked incredibly hard. I was like, I would never want to do this. This looks horrible. But with the removal of having the contact to the surface, it's got to be visually way less stressful to do endo with a laser.
When you do endo with the laser, you're essentially trying to clean out the canals with the laser. And the way you do that is you actually have one that has a tip on it, and that tip goes into what we call the chamber of the tooth, right? So you've gotten to the point where you've gotten to the main part of the nerve, and then you can get some of that out, and then you want to irrigate. That's the most important part of endo, right? Irrigation, cleaning it out, disinfection, right? So with the laser, I no longer have to go down into each canal like I do with shaping it. But when it comes to like cleaning it out, I don't have to stick that syringe with the cannula down into each canal. What I do is I have that in the chamber, and it provides like an ultrasonic chamber that is now creating these bubbles that is breaking all the junk and the dead tissue and bacteria off of the surface of the tooth and bringing it up and out. It's incredible what it does. Like you can see so much stuff come out. I had one case where this patient had internal root resorption. So it's like the tooth is breaking down from the inside, and it looked like a honeycomb on the inside of the tooth. There was all these holes everywhere, these intricacies.
Oh, it's internal decay from outside. Internal decay.
And so I was like, there's no way I'm going to use anything other than the laser for this. I guess maybe that was a big eye opener for me. So I used it for this.
So that case would have had to be referred out.
Oh yeah. This case, I saw, and I think it was a front tooth, if I remember right. And so we start cleaning it out, and we had to irrigate quite a bit. But I'm not in there trying to like get into every tiny little hole. But by the time I'm done, it is clean. It is the cleanest I've ever seen a tooth. It was amazing. And then when I go to fill it, you take a look on the x-ray and everything, and you can see where all the intricacies are because it got filled with your sealer and your gutta percha and all that radio opaque stuff that we put in there. So it was a pretty incredible feeling.
How long have you been on the laser journey now? How many years?
4?
4?
I think 4 or 5.
I think we got together 2 or 3 years ago now.
Mm-hmm.
It's been a few years that we've been together. And I think when we got together, you were just into the lasers. Like you'd been into it a little bit.
I think I'd been doing the master's program or something like that. Or starting at something.
First, thanks for coming on.
Yeah.
This is the kind of stuff that it's funny being the non-dentist, like in the dental community. Like I'm really jealous of the technology leaps you guys are enjoying right now, because I think a couple things have collided. I know a lot of people don't like the private equity money that's coming into the marketplace in the form of corporate dentistry and stuff. But what I will tell you is they have the ability to buy these bigger objects, and because that companies are willing to spend more money on R&D to develop these things now, because this extra money has flooded into the marketplace, so there is a positive there clinically, where a lot of these developments is being fueled by a lot of that.
Mm-hmm.
And I find that it's like a really exciting time. I had we had an episode with Dr. Sasha, and he's talking about augmented reality and implant robots. And
Mm.
I mean, implant robots like the X robot and the Mio, I think is the other one that I've
Yep.
been looking at. I mean, they're really, really awesome to me. They're pretty crazy. And now the augmented reality glasses is being worked on, where you wear the glasses as the machine's doing the work and you see the nerve in the glasses and you see exactly where you're at for perfect implant placement. I think it's pretty amazing stuff. And I think everything in dentistry now, technology wise, is just we're in like a technology renaissance in the industry where it's just exploding. And I'm always excited about the new next thing is. And lasers is a subject I've been wanting to put my brain around and haven't. I want to do more research after this episode now. But it's something where I don't think there's enough resources out there. Like if me and you were gonna go shop for a new DJI drone or a new laptop, we can go on YouTube and put in review of this Apple laptop, and
Yeah.
20 people did independent reviews, right?
Yeah.
If we want to find out about the Photona laser,
Mm-hmm.
it's like, who do we go talk to? Like, this might be one of the most informative things out there about the Photona laser. Like the fact that it does two, not one,
Mm-hmm.
is a big deal, right? And no one may have ever known that. And I
Yeah.
think it's really awesome to do episodes like this where people like you who actually use it are like, yeah, I picked this laser because of this reason,
Yeah.
and that's pretty awesome. So, is there anything you want to say before we get off?
I appreciate the time I had to share some of this because like you said, not a lot of people understand or know like what's out there, why to use what. They think, oh, I can use a diode and get away with a lot, and it's like, well, do you know what that means? Do you know what the gates are? Do you know what pulse modalities are? Do you know all these things? Does your laser even have that capability? Right. So it's the same thing with like my hygienists. Like they get taught something in school or in one of these courses. And I'm like, actually, I know what you're going to be taught. This is how I want you to use it.
Yeah.
And so I can teach them how to use it in the way that I think is best for our patients. So I just appreciate being able to come on here, share a little bit of my knowledge, and hopefully somebody will benefit from that. If somebody wants to reach out to me and ask me, I love answering questions about stuff like this. It excites me. It's what I love to do.
What's a good way to contact you if somebody wants? What's your email or something? What's a good way to contact you if that laser question?
Yeah, absolutely. So my email is drjustesen@gmail.com. So it's DR and then JUSTESEN@gmail.com. Probably the easiest way to get a hold of me.
Awesome. Well, Stephen, thank you for coming on. Hey guys, please click subscribe, leave a review. Please share the podcast. Me and Andrew do these episodes, and we don't get sponsors, we don't get paid. This is literally us giving back to the community that we believe in, that we work in, and anything that's on the podcast is stuff that we believe in or people that we believe in as being firsthand experts, and that's why we picked Stephen for being on today. He's in our stable of docs over at Energize. He's somebody I interact with a lot, and he's probably in my whole stable of probably 180 plus dentists. He's my number one laser guy and talks about it the most, has the most passion about it. We talk about, hey, let's do a laser episode. I said, the only person we can have is Steven. So, hey, thanks for coming on, Steven. Hey, guys, thank you and have a great day.